Scoliosis is, it means that you have a curvy spine. And really, there are two different big baskets of scoliosis. And so there's the young ladies or the young man's disease of scoliosis, where from a young age, and it can be even in a very young child, but usually it happens in an adolescent type patient in their teenage years, where they start to develop a curvy spine. And as the spine matures and grows, it continues to curve. And for those patients, there are some very specific metrics and measurements that we use, and the treatment options really are two arms in that group of patients, the younger patients. We call that adolescent idiopathic scoliosis. So the two treatment arms are bracing and then surgery. And so for certain measurements in certain age groups, we'll use a brace, and then for certain measurements in certain age groups, we will use a surgery to correct that. And then we have the adult patients population. Some of those adult patients have a juvenile or an adolescent scoliosis that's carried over into their adult life, and those scolioses will follow them into their adult life, and we'll continue to treat them in their adult life if they need that. The other patient population, though, is this adult patient population that has what's called de novo scoliosis, and it is a degenerative process. So that means usually in your 50s, 60s, or 70s, you start to develop arthritis that is so severe that it turns into a curvy spine. So de novo scoliosis means it's a new scoliosis that's formed in the adult life, and most often it happens because of degeneration or arthritis. So the spine is wearing out and we're starting to develop this curvy shape to our spine. And that can be very painful. It can be very painful because of the arthritis, just like knee arthritis or hip arthritis hurts in those areas. When you have arthritis in the spine, it can hurt around the spine. But it's doubly painful in the spine because the neural elements or the nerves can get pinched. And so when you start to get this curvy spine, where the foramen, which is where the nerves come out, can start to really pinch, and it can be severely painful in patients' legs or their buttocks area, or they can have deficits like their legs start to not work, or they have loss of sensation, or they don't know where their legs are in space because the proprioception or the sensors, for the muscles are not reacting right to tell them where they need to be. And so that's a de novo scoliosis, that's the adult scoliosis. In the adult scoliosis patient population, we don't really use a brace because it doesn't tend to be helpful. It doesn't tend to inhibit any further decline or increase of the curve. Usually we do some therapy, some injections, and then ultimately there's a surgery that we could use to fix it if we need to go into that realm.